That way you're nice and safe in that 90 degree. So you could feel the amount of work even though it was only a few reps.
Yeah.
Throughout the day, do a little bit here, do a little bit there. Okay. Time for a break on the camera.
Okay.
Yeah. That's it.
Oh, should I take my slippers off?
No, you're fine, unless you want them off. So you can go as high as 90 degrees, and because you've just had a hip replacement, you won't go over that in standing at the moment because it's too hard.
Yeah.
So you go to where it's comfortable. Day one, you go to where it's comfortable. You can put as much weight through that new hip as you want to, but you're not going to want to put all your weight and walk with the cane just yet. That's it. You might do 5. You're not going to do 30. Okay? Then move your walker ahead of you a little and take that right foot out to the side.
Ooh.
Now if that's tricky, just slide on the floor. That's it. A bit of ballet. There you go.
Do both sides?
No,
okay.
just the right. So you're right. Usually when we do any physio or yoga, we always do both sides for balance. But if you did your left side, you mean putting all your weight on your new hip, and it wouldn't be very comfortable. And there's nothing wrong with the left side, so it's not going to get suddenly weaker. That's it. Good. And then can you bend your knee? Lovely. Come forwards a little bit. That should be a bit easier. So if you come forwards again. If you come around this side, you'll see better.
I didn't want to get in your way.
We had a photographer in England called David Bailey, and when my husband's doing this, we call him David Bailey. It was like the what's the name? Oh, the famous. You're just bending your knee. That's it. And now go out to the side, sliding on the floor, and sliding back. That's it. And then going in front, lifting it up. That's it. Need a little rest? So walk yourself back. That's it. Leg out. There you go. And that's, the arms really help.
Yeah.
Yeah. And then you could rest.
Right, and that's what hubby was saying. Sit back.
Yeah, just rest back a bit.
Yeah.
And then to get up, you'd have that right leg out in front, come up on that left. Oh, yep, you got it. And you have a raised seat in your
Oh, it's not in there yet.
Okay.
We had one.
Good.
But it's not,
Didn't need it today.
no.
No. But yeah, I checked with him when, just common sense says today, but he confirmed.
Yeah, I don't feel like a bath today.
No. You feel like getting a shower over your neck and your hair in a couple of days, but
Yeah.
you don't need to. And it's a waterproof dressing with antibiotics in it, so
Okay.
it's a good. So let's have you going, sitting and resting. So you have you've had something to drink today, but
Yes.
nothing to eat yet.
No, I ate. I did eat.
Oh, okay. Good.
I had a sandwich and coffee
Perfect.
and lots of water.
That's it. Doing great. Okay, let's see you come to the chair. And you're gonna back up. Feel the chair backs of your legs. Stick that right leg forwards and lower yourself down with your hands. There you go.
Yeah.
And if you wanted to put your foot on the footstool, you can. So if it feels comfortable,
Right.
it just you have to take the stool away before
Before
you
you
get
get
up.
up, right.
So if you're around today,
Yes.
Yeah, he's
so as
around for
long as you're not sort of trying to kick it out the way.
Right. No.
Because if that might feel like it's pulling, if it's not, if it's comfy, that's fine. But if you want to,
Because I found when I was sitting here, after a while, it felt like I needed to raise it.
it looks like that.
Yeah.
And that's a nice height.
That's
Not too high.
Okay.
That's it.
Yeah.
So yeah, having the stool's fine, but someone else putting it in, taking it
Right.
out for you, just
Okay.
keeps it safe.
Okay.
But don't fret too. That height's fine for you.
Yeah.
Absolutely fine. Did it feel too? Were you slipping?
No.
Okay, as long as you don't feel like you're slipping. The height's great
Yeah.
because you're nice and open in that hip.
Okay. Yeah, and it feels more comfortable
Just a
than
bit
that
more
one.
to it. Now if you get up, using your hands, again, left leg's bent, right leg's out in front. Oh, beautiful. Yeah, perfect.
Yeah.
Okay, let's go see you walk to the bathroom and check your raised toilet seat. And again, put as much as little weight as you're comfortable. Are you getting tired?
No, I'm good.
When I was a junior physio in Oxford, we would meet, like you and I met before surgery,
Right.
but it would be the physio, the OT, the surgeon, the surgeon's assistant, the junior doctor. I mean, it was like a room of white coats, and the most junior doctor had the mark pen, and he would do an arrow because there had been mistakes at some point, and yeah, you're not best pleased if your other hip was fine and
Yeah,
got it
for real.
replaced. Comfortable.
But it's just amazing how I have no pain now on this side. That is so weird.
So it was referring.
I mean, like, unbelievable. Even walking,
It's more comfortable on the left.
no pain.
It is. Are you putting more weight on this leg now because it was so painful before?
Yeah. So I'm trying to
It's a bit more
balance it
evened
out. But it's like even in the being even, there's no pain on
Yeah,
this side.
not even a bit. You'd expect a bit.
Yeah, I'm like, am I okay?
We'll see when the meds really wear off.
Yeah, for real.
Because all those lovely medications are also helping
that's
the
what it
arthritis
is.
on that side, which is fine.
Yeah.
Yeah, you've got a nice good dose of anti-inflammatory, you've got some
Right.
good regular painkillers.
Right.
Where when you have arthritis, you tend to take it when you need it, save it for the bad days.
Right.
You don't take it every day because
Right.
it's such a long haul. You don't want to be on pills all the time.
Right.
But right now you need to be on
So
them.
that could,
So the pills are probably helping
that.
beautifully.
Yeah, because
But also, it's not having to do double duty.
right.
Yeah. Okay, bend up. This joint's moving really nicely. What I might do, if you're okay with it, is to put an extra cushion on your chair.
Okay.
It might be too high, we'll see, because you're not overly tall.
Right. Right.
But we'll see.
Okay.
Just to have you a bit safer.
Okay.
Okay, and up. And gently down. Bending up. And down. Now, pull your toes up towards you. Can you lift your leg? The whole thing? No, fine. No, you were really good. I thought, I'll try my luck. Okay, bend up. And down. And now just lift that lower leg. That's it. You've been doing these already, haven't you?
Yes. I was obedient. You
That's
told
right.
me to go home and do it.
Just get some strengthening. Perfect. Lift it, toes up and hold it. Hold it. And slowly, slowly down.
So last night, it's like I had a lot of pain in here,
You're fine.
in the knee, like in
I
there.
wonder if it's from them holding your leg.
Okay, because I'm
Because
just
that's,
right.
they probably do have their hands above the knee joint. Not
Yeah,
below, but,
It was like right above. Yeah,
I wouldn't be
I was
surprised.
just like, why is it so painful?
Yeah, I don't know for sure, but thinking of the videos I've seen in the past, I think they are
Okay.
holding it like, yeah. Calf is lovely and soft, and again, you don't get a blood clot overnight.
Right.
They take days to
form.
But yeah, it's great. So you know today I could squeeze your calf, it was absolutely fine. If you know that changes, we know it's changed.
Right.
We know it's not good. Yeah. Ankles, and you're fine wearing these, you keep the swelling out of your ankles. Although to be fair, even your thigh doesn't look that swollen. Yeah, a little,
Yeah.
but not
Over.
as big as they can look, that's for sure. Okay, bend that one up again. It just helps to level your pelvis. And lift this one up. Now the last one, which if it's too uncomfortable, you just do it in standing, is to slide your foot out towards me and back again. Yeah. It's a bit harder, isn't it? So, which is what you find when the standing is the out to the side. It's because that's the muscle they cut through. They don't cut it in half, but they cut very close to that glute muscle. So you work on them standing, sliding your foot is easier, and this will get better.
Gee, I haven't done this in over a year.
Gosh. I know, it's amazing, isn't it, how quickly. Okay, bend your knee up. And the other one. And gently open your knees. So, and then bring them back together.
But it's not to shut the ear.
Yes.
There we go.
Absolutely decent. And now open up and bring it back in. Same muscle that you were using to slide out to the side, but with much shorter lever, so it's a little bit easier. But you can feel it pulling up here.
Yeah. You know, my biggest fear, like watching videos and stuff, was the when they talked about dislocation. You know, so I'm like, I'm doing everything so I don't dislocate.
Good. As of this year, gosh, I started training 40 years ago, which sounds horrendous.
Yeah.
I've had one patient dislocate.
Yeah, I said, I'm not going to be number 2.
You're not going to be number 2 of my last year of
Sorry.
work. Thank you very much.
You're not going out with a bang.
So that's why I want to just check the height when you get up and get down. That's why I sort of reminded you to put this leg out in front and to bend back
and I have to remember
not to
that.
pull up. Okay. So have a rest. If you
should I take my slippers off?
No, you're fine, unless you want them off. So you can go as high as 90 degrees, and because you've just had a hip replacement, you won't go over that in standing at the moment because it's too hard. So you go to where it's comfortable. Day one, you go to where it's comfortable. You can put as much weight through that new hip as you want to, but you're not going to put all your weight and walk with your cane just yet. That's it. You might do 5. You're not going to do 30. Okay? Then move your walker ahead of you a little and take that right foot out to the side. Ooh. Now if that's tricky, just slide on the floor. That's it. A bit of ballet. There you go.
Do both sides?
No,
okay.
Just the right. So you're right. Usually when we do any physio or yoga, we always do both sides for balance. But if you did your left side, you mean putting all your weight on your new hip, and it wouldn't be very comfortable. And there's nothing wrong with the left side, so it's not going to get suddenly weaker. That's it. Good. And then can you bend your knee? Lovely. Come forwards a little bit. That should be a bit easier. So if you come forwards again. If you come around this side, you'll see better.
I didn't want to get in your way.
We had a photographer in England called David Bailey, and when my husband's doing this, we call him David Bailey. It was like the what's the name? Oh, yeah, famous. You're just bending your knee. That's it. And now go out to the side, sliding on the floor, and sliding back. That's it. And then going in front, lifting it up. That's it. Need a little rest. So walk yourself back.